Hi, I'm Andrea Askins, and I wanted to talk to you guys today a little bit about my dad's story and his journey with pancreatic cancer, adenocarcinoma. My dad was diagnosed on August 26th of last year, and unfortunately passed about 8 weeks later after a really tough battle with pancreatic cancer. And this, the reason why I'm here today is because I feel like I need to share his story because it caught us by surprise. My dad was only 63 years old. He was young and great health, took care of himself, and it was a shock when he was diagnosed with pancreatic cancer. And the symptoms were so subtle that they were really overlooked because we weren't prepared for that type of diagnosis. The symptoms that he had were back pain, mid back pain, and that's really it. And when I look back at his journey. I really feel like he had been sick since around February when he was complaining about more back pain than usual. And he was going to the chiropractor a little bit more. And he didn't realize that pancreatic cancer was going to be even on the radar. He had been diagnosed with Hodgkin's lymphoma in 2016 and survived that quickly. It was stage 2B, and it was really just a surprise because he had gotten a scan in May and they did not find any pancreatic cancer, no liver lesions. And then by the time August 26th came around, he had so many liver lesions that they could not count them. And that was really scary. That was scary to me as his daughter. That was scary as a Mexican American. As I was looking at all the stats, I found that it really is impacting my people and our population. And also with the fact that my dad was diagnosed with diabetes just about a year and a half earlier, one of the common symptoms of pancreatic cancer or precursors to that. And so I do wonder, what could have been done if we had been aware. And that may not have changed his outcome, may not have changed the diagnosis, but what can I do for myself to get me ready just in case I have a similar diagnosis? And at that point is where I decided that I was going to partner with UT Southwestern and work with my primary care doctor to get into genetic testing with our my partner here today, Cheyla Clark. And I'm really excited to be able to have a conversation, my journey about my genetic testing and a little bit about my results to hopefully help future people be okay with genetic counseling and have knowledge of this.
Yeah. Thank you so much for sharing your story, Andrea. It's really powerful, a really powerful story and really powerful information that we can get from that. So as Andrea mentioned, I am a genetic counselor. My name is Cheyla Clark, and my specialty is cancer. But in general, genetic counseling is a process of helping people understand and adapt to the medical, psychological, and familial implications of the genetic contributions to a disease. So anything that we experience health-wise can be genetic. We help patients and families understand complex medical information, facilitate their decision-making around what they want to do with that information, what they want to do about genetic testing, and adapt to the genetic condition or risk that they have. And so overall, we are into professionals who who have specialized education in genetics and counseling to provide this personalized support about our patients and our family's genetic health. We're clinicians, advocates, and educators. So I personally I've been a genetic counselor for about 2.5 years. And I've worked in the specialty of prenatal, where my patients were pregnant women, and now I'm currently working at the cancer hospital with a specialty in genetics. So particularly when working in cancer genetics, we see patients and families who are affected with cancer or have been affected with cancer, and kind of have those discussions around the genetics of it all, the familial contributions, the environmental contributions to cancer, and kind of talk about that and where genetics and genetic testing fits into it all. So, and this is how I came to know Andrea and her story and her family history. And we just want to talk to you all a little bit today about how we work together to kind of get answers and clarity and decide next steps.
So I wanted to talk about a little bit about what my next steps were and how I came across this particular program, and Cheyla and I met. And what I did is I partnered with my primary care physician. I have a primary care physician that I've actually been seeing since I was 7 years old, and I'm 39. So he really has seen my whole family history. I know not that may not be the case from everybody, but I do want to stress the importance of a relationship with your primary care physician. As I was going in for an annual exam, my doctor and I were just discussing about my dad and his situation. And we started talking about some of the other cancers that ran into my family. And he suggested genetic counseling. And I went home, thought about it, and then I looked on UT Southwestern's website and found that we had a genetic counselor. And I chose Cheyla specifically because of her experience with cancer and working in the cancer center. So I asked my doctor for a referral. He gave it to UT Southwestern. I got a phone call in about a week. And I think about 2 weeks later, I had an appointment with Cheyla. So it happened pretty quickly. And Cheyla and I got together and mapped our family tree. And I found that process really interesting. And Cheyla, I wanted to go to you to talk about, how you guys do that, what you look for.
Yeah, so when we are taking a family's or a person's family history, we ask very specific targeted questions depending on the specialty we're in. So again, for cancer genetics, we are looking for patterns of cancer happening in the family. So questions that we ask, we get the family structure. Like for Andrea, asked, how many children do you have, siblings, how old are they, have they ever had cancer, at what ages? And I go through that for each family member. So ages in which cancers were diagnosed matter when it comes to genetics, because some red flags are cancers happening at a younger age than expected. So we do know that unfortunately cancer is very common. So we look for the more rare things. Are there's cancers happening at a younger age than average, than normal? So that's why we ask about ages. We're looking to see, are cancers happening in the same side of the family in each generation, because that looks a little bit more suspicious than more sporadic cancers popping up in random areas of the family. So we are very strategic with the questions that we ask, so that we can elicit this type of information and paint this picture. So the family tree or the pedigree kind of looks like a structure where we have Andrea's whole family, her children, her siblings, her parents, her grandparents, and aunts and uncles, so that we can literally get a picture of what the cancer is looking like in the family.
And in my particular situation, there was a pattern of cancers on both sides of my family. They may or may not be related, but it does potentially put me at a higher risk, which at that point, Cheyla partnered me with the pancreatic cancer prevention program here at UT Southwestern. And I was able to go in for my first abdominal MRI scan earlier this year. So it was back in March. And I am eligible to be able to get scans every 2 years to hopefully, if there is something or something that does happen to me, that we can catch it on the earlier stages versus being reactive. So we're taking a more proactive approach to my health. And Cheyla, I would love for you to tell the department or everybody about the process of getting me in contact with that and setting up the referrals for the MRI.
Yeah, so once we did the genetic testing for Andrea and we found that she was negative for any genes related to the cancers in her family, we then had to think about the fact that maybe the pancreatic cancer that was occurring in her father was more of a sporadic or environmental type of cancer and not anything due to a genetic cause that we can find at this time. So when we have a patient that has a negative genetic test result, but a positive family history of cancer, we do refer them to specific clinics so that they can get cancer screening for that. So in Andrea's case, we wanted to refer her to our pancreatic cancer screening program that we have here at UT Southwestern. Because of her family history of pancreatic cancer, she does have a slightly increased risk to develop that over the average person in the general population. So I sent over all of her information, her clinic notes from our visit, copy of her genetic test results, sent a referral to the pancreatic cancer clinic, and then I believe they called her and got her in pretty soon thereafter and got the process of the screening protocol started.
Yes, and I found that really fascinating that I was able to go in. It was covered by insurance, and even though I don't have the genetic risk factor that we know of at this time, we do know that I have multiple cancers in my family that may be unrelated, may not be, and still there's a lot of unknowns, right, Cheyla,
Yeah.
about genetic testing and counseling.
Yeah, there's many unknowns at this time. And one thing to know about genetic testing is the test is only as accurate as the information that we have at the time. So science is constantly evolving. We're constantly making more discoveries, and we are able to test for more and more things as time goes on. But at the time, for what we tested for, we did not find anything genetically linking the cancers in her family to a mutation that she might have been born with, giving her a predisposition. So that's why we urge anybody with a family history of cancer, one, to have a consultation with a genetic counselor, two, see if genetic testing is a good option, and three, if testing is negative, we still need to screen for those cancers that we see in the family, because there is a familial component to cancer. So on one hand, we have a large piece of the pie where most of cancer happens completely sporadically. It's a combination of environmental factors, lifestyle factors, and just our heredity, just our genetics. And then a smaller percentage of the time, we see cancers clustering in a family, like Andrea, where we'll see many cancers happening to many family members, but we haven't found a genetic link for that. We call that familial cancer. So we see it running in a family, and sometimes that might be because we share an environment, a lifestyle, and our genetics with a family. So we have similar risk factors. And then small percent of the time, only about 5 to 10% of the time, are we able to find a genetic inherited cause for a person's cancer risk. So that's what we look for when we do genetic testing. And if we don't find anything, it kind of falls into that familial or sporadic category that we still need to do increased screening for.
And I may be mistaken, but is it correct that there's not as much data for Black and Brown and minority populations? Is that correct?
Yeah, so in the database of the human genome that we have, at this time, majority of the genes that have been contributed to that database are from individuals who come from European backgrounds. So over time, we are trying to recruit more and more people to do genetic testing so that we have a bigger variety of all of the ethnic groups across the world contributing to this database so that we are able to get more accurate information on everybody, no matter their ethnicity, no matter what country they're from, no matter what their genes say, that we have information on everybody. So we do often get these test results. They're called variants of uncertain significance. Andrea had one of those on her test, and they are more common in people who are not of European ancestry, just because there's an underrepresentation of lesser or non-European ethnic groups in the database.
Yeah, so I highly encourage, as as somebody who is Native Mexican American, I really encourage people to go and take advantage of this genetic counseling. It is covered by insurance, so if you have insurance, it is covered. So I only had to pay my copays, and I feel very fortunate to work for UT Southwestern to have some awareness
Mhm.
of these opportunities.
Yes, and to that point about insurance coverage, many insurance companies are covering the cost of genetic testing now. Years ago, 15, 20 years ago, genetic testing used to cost upwards of $4,000, $2,000. Now, if a person wanted to pay out of pocket for a test, if their insurance wasn't covering it or if they were uninsured, the cost has now come down to about $250, which can still be a lot for some people, but it's much more affordable than it used to be.
That's awesome. That's fantastic. So, if somebody were to want to take advantage of genetic counseling, how would they get in contact with you?
Yeah, so you can always ask your primary care physician or any other specialist that you see for a referral to a genetic counselor. But if you wanted to be your own advocate and take it into your own hands, we have a website called findageneticcounselor.com with an entire database of genetic counselors across the country that you can search for in your zip code and see, and then reach out to them and ask for an appointment or contact their office directly.
Perfect. Thank
And
you so much for that.
yeah, and here at UT Southwestern, we accept self referrals. So you can Google our cancer genetics program and request an appointment online. You can call our department phone number, and we can get, like Andrea said, patients scheduled within the next couple of weeks.
Yeah, it was really quick for me, so I highly encourage and painless. We did it virtually, and I just want to say from my perspective, Cheyla, thank you for what you do. I'm so fortunate that you and I met, and I'm thankful that you were a wealth of knowledge for me and an advocate for me for the pancreatic cancer program. I appreciate you.
Thank you so much. And we love patients like you who are also advocates for us. Many people don't know that genetic counseling exists, and it's patients like you that are strong advocates in their communities that get the word out to help their communities, help other patients, and help us reach as many people as we can. So I appreciate you for all that you do.
Absolutely.
Thank you for joining this episode of Let's Talk About It, where we explored pancreatic cancer. We urge all of you to take proactive action in your health of yourselves, your families, and spread the information that you learned here today. Thank you.